blood supply of heart, in which we will look the features of coronary arteries. These arteries are functional end arteries. Means what? They anastomose with each other, but one cannot compensate for the other artery in case of thrombosis. Now the ascending aorta gives rise to two branches, right coronary artery and the left coronary artery. The right coronary artery, you can see, it arises from the root of the pulmonary trunk and here somewhat the right auricle. So between root of pulmonary trunk and right auricle, right coronary artery arises. And the left coronary artery, you can see, it arises from between pulmonary trunk and left auricle. In between this there is left coronary artery. The right coronary artery extends downwards, and here it gives off a branch, marginal branch, which is running towards the right margin of the heart. Then it continues the right coronary artery further and goes behind across the coronary sulcus, goes behind posteriorly, and it again gives off a branch over posterior interventricular groove, that is posterior interventricular branch. Then it continues further. Okay, now the left coronary artery here somewhat it gives a branch known as anterior interventricular branch over the anterior interventricular groove. Then it again continue further to the left as circumflex branch and it goes behind. Okay, then this circumflex branch and the right coronary artery meet behind an anastomose. Okay, here is the anastomosis. Next, the posterior interventricular branch, which is given off by right coronary, and the anterior interventricular branch, which also goes behind, and they anastomose with each other. So this is the whole arterial supply. Then the right coronary artery and left coronary artery gives off some small little branches, okay, which are very important from terms of accessory branches. So the right coronary gives SA nodal artery to SA node, supplying the SA node, and the left coronary artery gives diagonal branch, okay, which is the largest branch. So just quick recap that we have seen two major anastomosis. One, the right coronary artery continuing, and the circumflex branch of left coronary artery. Here there is anastomosis. Then the anastomosis with posterior interventricular branch and anterior interventricular branch meeting posteriorly.